Let's bring in someone who knows that this disease is very, very real. Dr. Lois Mbajo, head of infectious disease unit at the Kenyatta National Hospital. Dr. Mbajo, thank you so much for your time. Really quickly, you've heard Jeff talk about what he's been doing, taking different concoctions, hydrating, taking different vitamins and minerals and whatnot. I mean, what should someone ideally be doing? They test positive, they've been told self-isolate. What do they do?
Thank you so much, Vicky, for having me on your show. And thank you, Jeff. And even before I start, I want to tell Jeff, thank you for telling people about your diagnosis. You've probably done more to inform people than we've done than we managed to do in the last 4 months. One, to reduce stigma, because now everybody knows anybody can get it. We really do not need to stigmatize others. So thank you for doing that for us. And then in terms of what to do for treatment. So if someone has no symptoms, then chances are you don't really need any treatment. Most people will have absolutely no symptoms. So the most common symptoms you'd ordinarily see are maybe cough, fever, loss of taste or loss of smell. Some people will have a sore throat or a running nose, but some people will have absolutely none of those. So in that case, you really don't need any treatment. All these treatments that Jeff has mentioned have been touted world over. You know, drink hot water, drink lemon, rub salt on your nose and on your skin, but we do not have evidence that they actually make a difference. For some of those, like drinking some water with ginger or lemon, it's not harmful. And if someone has sore throat or a running nose, they may offer some relief. So not harmful, and someone can take them if they offer some relief. If someone has a sore throat, they could gargle some salty water. If they have a headache or a mild fever, then they can take some Panadol or paracetamol to relieve that. What's important, though, is that people do not self-medicate. You know, if someone is going over the counter to buy all manner of medicines, remember some of these medicines could be harmful. And it is important that you don't self-medicate, and that if we have symptoms that are bothering us beyond what we can handle, then it's important to get medical care so that you are given the right medication for what's going on.
So really, it's you treating yourself symptom by symptom. It was interesting today, we heard the Health CAS, Dr. Aman, talk about how successful the home-based care program has been. In fact, today he mentioned 406 out of the 499 recoveries were of patients who were in the program. Why do you feel it was, or why do you think it's been so effective?
So remember, the people who go to home care are those who have no symptoms. Also, we do not send anybody who's at risk for severe outcomes, so to speak. We don't encourage that person to have home care. So if we have an elderly person, someone who has poorly controlled diabetes or has heart disease, then it's best that they're in hospital so that in case they get worsening of symptoms, then care is available nearby. So to start off with, the person who's on home care is the one who's likely to do well anyway. So that means that most of those people will recover without any issues. So maybe that's why we have a lot of people who are now being reported to have recovered. They went into home care, they've spent a certain number of days at home, they've not reported any symptoms, and now they can be allowed to de-isolate, so to speak, so they can get on with their usual business. So because of that, we're going to be seeing a lot more people who are reported as having recovered, because one, the people we send for home care are those who are likely to do well.
Right, and I know Jeff had a few questions for you, Dr. Jeff?
That's right. Dr. Lois, thank you so much for your kind words, first of all. Real quick, some of the people I was in contact with, let's say over the weekend, right before I tested, have tested, and God willing, all of them will be negative, but a lot of them have come out to be negative. Explain that to me, please.
So I guess there's some sort of rule of probabilities with every single disease. So 5 of us could be sitting in a room and exposed, and only a few of us will actually get the infection. So that's one. Not everybody who gets exposed gets infected. And I guess that's a lot to do with how much of the virus they got at the time of infection, how strong their immunity is, as well as other things that we may not be able to explain. The other thing is that when you're tested really determines when you get positive. So if I had contact with someone who was positive yesterday, and I go for a test today, it's highly unlikely that my test will be positive because it takes some time for the infection sort of to set root and for, the cells to start shedding this virus. So that's why we encourage that if someone has been exposed, often they'll start shedding the virus no sooner than 48 hours. So it will be at least 2 days to maybe several days after the exposure. So the timing of that test is also important. That's why we say that if someone has been exposed, even if they test negative at an initial test, it's important that they stay in quarantine because they could very well turn positive over the next 2 weeks after exposure. So timing of that test is also very important. One, we don't know why some people don't get infected, but that timing is also very crucial.
And Dr. Mbajo, just to talk about how peculiar...
Thank you for highlighting that, yeah.
Yeah, absolutely. Just to talk about how peculiar this disease is, when it comes to who's more susceptible than the other, there's a whole debate as to why men are more susceptible or affected by COVID-19 than women are. And is this just unique to COVID-19? Do we see this with any other diseases?
So for COVID-19, it's true. Even if you look at our statistics in country, more than 60% of those who are infected are men. And even if you look at those who have more severe disease, men are more likely to have severe disease. This has been seen in most countries of the world. I think only South Africa at some point reported that they had more women than men affected. But most other countries have reported more men being affected. And there are many reasons for that. The main reason is that we have no idea why, but it could be to do with maybe hormonal differences, some differences in immunity, but we don't really truly understand why that is. There are a few other conditions where we see one gender affected over the other. Sorry, you wanted to say something?
I was just going to say, Doctor, you're so right, because Vicky and I, we do Sunday Live together. I tested positive, Vicky tested negative, just like that.
Yeah, so we don't always know why. But then if you think about, there are many conditions where you may find one or the other gender affected. So there's some, especially conditions that cause a lot of inflammation, things like lupus, rheumatoid arthritis, which would largely affect women as compared to men. Then there are some infections that you may find that more women are affected. For example, if you look at the issues around HIV in this country, you'll find it's more women than men for various reasons. Maybe some gender would acquire an infection more easily than the other. But for this particular one, we're still looking for the exact answers to why men are affected more than women.
Right. And I'll tell you, I was relieved when I got that call from my boss, Washira Waruru, saying that I was negative. But there could be a plethora of factors as to why. Really quickly, we were seeing some very alarming headlines in local daily today about mass graves and body bags being put aside for the anticipation of deaths due to COVID-19. According to the National Steering Committee on COVID-19, they say as many as 30,000 Kenyans may die in a worst-case scenario. What does that worst-case scenario look like? Or is that just alarmist propaganda being spread?
That's a difficult question because it's a difficult reality to face. But the truth is, if we look at what other countries have had to go through, we've seen them get a large number of infections, a large number of people requiring critical care, and a large number of people dying. If you think about it, world over, more than 500,000 people have died. So I think it's only realistic to expect that we may have some mortalities in country. And the extent to which people get infection, the extent to which we get people who get severely ill, and the extent to which people die will really depend on how much we let this infection spread. We know that there are certain groups of people that may be at higher risk for getting very ill and at higher risk for, dying. So it means we really need to shelter those people so that they're not getting infection. And that would mean we start thinking about the elderly and those who may have significant other conditions, that we shelter them, that we make sure we don't expose them. People in Nairobi shouldn't rush to the village to see the elderly, because we are thinking about how to protect those who are most likely to get severe disease. In terms of worst case scenario, and I think this has been presented when the president talked about it during one of his addresses, when he talked about if it was unmitigated, we'd probably have about 40,000 people die by the end of this pandemic. And that's a scary number. We don't really want to imagine that. So we really have to do something to turn this tide. And that's really around our own responsibility and how we, protect other people.
Certainly, and one life. Yeah, go ahead, Dr. Mbajo.
Maybe just to add to that, for those who are on home care and are self-isolating, it's so important that we maintain that self-isolation so that we are protecting other people from getting this infection. So the essence of home isolation is that you stay away from other people until such a time when you are not at risk for passing on the infection to them. So it's important that anyone who's diagnosed and sent to home care stays home even though they're feeling well. I know it's often a challenge to stay home. If Jeff is waking up at 4 a.m. and walking around the house, it's tempting to get out there. And if someone is struggling to make ends meet, then it's also tempting to leave the house and go around. But it's so important that you maintain that self-isolation. One, so that you get better, and also so that you really protect everybody else from the infection.
All right, Dr. Mbajo, thank you so much for your insights and, as always, your time. And I'll give the last word to the patient before we go to break. Jeff?
Great interview and great insights there by Dr. Mbajo, Vicky. I mean, I learned quite a bit in those few minutes. Thank you so much for that. Look, folks, it's a reality. You listen to Dr. Mbajo, it's a reality. This thing is real. Do not be in denial. If you feel the symptoms, if you feel any signs, get checked. Get checked, folks. Protect the ones around you. Again, I'll quote C.S. Mutahi Kagwe. You can get it. I have got it. We all can get it. Vicky?
And on that note, let's take a short break here on JKLive. Much more